So it should, yeah. But
I've just got something that says it's streaming on Facebook.
Yeah, this is good. This is looking positive.
Remember the last time we did this? It took us about half an hour, didn't it?
Right. So there we go. I'm just going to double check, but I think we should be live. If we are, people, bear with us.
Right, 2 seconds.
I'm so impressed.
You're ready. You're live.
I'm live. Okay, everyone. So those, I know we've done a few Zoom sent Facebook lives. I have no idea how it works. Holly sets it up, but I think we're good. I think we're live. So those of you who are joining us, so usually I know when I'm doing these lives on the Ayurvedic Mentor, obviously I'm talking, you guys can comment, but this isn't on Facebook, it's in Zoom for Harriet and I. So if you want to ask a question, just type it in the Facebook page and I'll get it on my phone and I can answer them that way. Okay, so do interact like you guys usually do. The only difference is I can't see who's joining. Okay, so all you guys signing, I can't actually see your names because I'm not on Facebook, I'm on Zoom. So I'm not being rude through not saying hello. I just can't see your name. So thank you guys for joining us. This is our fourth, I think, kind of live interview on the Mentor platform. Can't wait to get into the nitty gritty of what we're talking about because it's been, Harriet and I were just talking before you came on about I guess the synergy between the reflexology, the TCM, the traditional Chinese medicine and Ayurveda and how it all ties in. So looking forward to really exploring the nitty gritty. Before I do that, I just want to explain, before we introduce Harriet, just explain why Harriet is here, why she so kindly agreed to join us. Because over the next 4 weeks in the Ayurvedic Mentor, our theme is going to be the facial reflexology, lots of the anti-aging facial approaches and the whole gamut of it all wrapped up into a 4-week series. So I've watched the training sessions, obviously, and they're immense. They really, really blew my mind. And I say that with absolute sincerity. It was a real eye-opener for me. 1, because of how powerful they were. 2, because of how deeply rooted they are in the mechanisms of the body. And 3, because of the synergy between that system and how it's so closely linked in with Ayurveda, even though they're poles apart in terms of culture. So just quickly, how the series will work. So next week, 7:30 next Wednesday, we've got a live training workshop with Harriet here. She'll be doing a live workshop on facial jaw tension. And we're going to talk about that in detail tonight because I actually did that with Harriet last year. And again, it was just an amazing, amazing experience. So that is one not to miss. Okay, next week. 7:30, and there's going to be 3 pre-recorded videos that are going to be released over the coming weeks after the live. One on the gua sha, which I think that's the right pronunciation, which is a brilliant sequence on facial massage, reflexology, anti-aging. They're looking at the meridians and energy systems, and they're looking at some of the facial acupressure. Okay, so they're really, really, they're not just very powerful, they're also a lot of fun. It's really great to practice. It's really great kind of getting metaphorically your hands dirty and just getting in and doing this stuff. It's really, really interesting. They're tools that are easy to integrate and easy to implement. So really, really excited about that, this series and what it's all about and what it represents. So with no further ado, let's introduce Harriet. Harriet, thank you so much for joining us.
Thank you so much for having me. And
thank you obviously for all the amazing content. So welcome to the Ayurvedic Mentor. These guys, I think we've got about 300 people members on here, and they're some of the most, inspiring and motivated and kindest people, we've ever had the privilege of working with. So they're a great community. It's a real privilege to introduce you to them. So before we get into the nitty gritty, can you just tell us a little bit about you, how you got into this world? How did you find reflexology? What's your training? What's your background? Who is Harriet?
Okay, so I am from Yorkshire originally, and actually it was my mum who started to dip the old toe into the alternative medicine. My mum is a really keen gardener, and there was just books everywhere about herbalism and aromatherapy. She, I mean, loved aromatherapy. She never trained in it, but it was something that she brought to me and my sister, and I just have such fond memories of her trying to heal tummy ache with orange oil.
Yeah.
So I was always kind of surrounded by this, and I was very, very interested in it. And my mum had a lot of friends who used clairvoyance and psychics. So from a really early age, I was very much interested in everything alternative. My kind of life trajectory always revolved around being an actress. So that is one of the many things that I do. So my whole life was towards acting and being a performer. And what comes along with being a performer is burning yourself out. So I think what most people don't realize is the kind of detrimental effect that getting up in front of thousands of people and hitting your nervous system really hard every single day starts to have. And I was doing a job, and I started to feel not great, and I'd not been feeling great for a while, but I just kept going. And it was when I was doing a pantomime about 5 years ago, my kidneys decided to take a little hiatus. So I had recurring kidney stones that nobody was diagnosing, nobody was comprehending, and basically sent my kidneys septic. So that was not great. But obviously I'd been in this culture of Dr. Theatre will get you through it and you can keep going and push. Anyway, I was taking a lot of morphine at the time, and I heard a voice crystal clear tell me to go and do my yoga teacher training.
Wow.
I was like, okay, well, I've never heard that before, so I guess I should. So that was the beginning of me trying to get my body back together, and I felt completely obliterated by the whole experience. Not only had I failed in my profession, I'd completely lost any connection or comprehension of being in my own body. So I kind of dragged myself to a yoga class, and I'd done like bits of yoga, I'd done Bikram, but like full disclosure, it's because I wanted to be, you know, tiny and sweat out all of my body fat. So this was my first interaction with yoga as a therapeutic tool, and it was heaven. And I'd trained to be a yoga teacher. I was first introduced to principles such as Ayurveda, and it literally felt like somebody had just opened Pandora's box. And suddenly I just had all of this information, all of this new cultural information handed to me, and I just started voraciously learning. So actually Ayurveda was my real first interest, and I never really quite, I mean, it's so complex. I've always kept like a very surface understanding of it, so I'm really looking forward to actually learning from you and really deepening my understanding. But from there I started teaching yoga and loved it, and actually it was a really fantastic supplement to my acting career, and I kept meeting reflexologists. So I kept meeting all of these women and having these amazing conversations, and I never even had reflexology. But what I hadn't actually realized at the time was part of me healing myself without even knowing what I was doing. I'd started to massage my feet because I was in so much pain with my kidneys, and I couldn't sleep, and I was getting plantar fasciitis, which in Chinese medicine is oftentimes related to kidney yin deficiency. So I'm like textbook Chinese medicine problem. But anyway, I started to rub my feet, and I found it really powerful. I could sleep and the pain was going. So I was meeting all these reflexologists and having all these conversations with them and thinking, how have I never heard of this before? And this is what I'm actually doing on myself and having really fantastic results. So I said to, you know, the universe, God, source, whatever you want to call it, introduce me to one more reflexologist and I'll do my training. Anyway, I did. And so I thought, right, okay, well, let's do this. And the minute I signed up to that reflexology course, I actually have never been busier as an actress in my life. So I was doing UK tours and then training at the weekend, and voraciously trying to absorb all of this information. And I was bringing it with me on tour and using it on all of the actors and using it on myself. And I could not believe how powerful it was.
Yeah.
So I was finished that tour and I started to practice, and I was doing yoga and reflexology, and then COVID hits.
Yeah.
So it's like, oh, great. So none of my occupations are vital in a pandemic, which was interesting. So I then from that point was like, okay, well, what have I always wanted to learn about? And I've always been really interested in Chinese medicine, but I wasn't ever going to go back and do a degree in acupuncture. It wasn't something that I wanted to do. So I started to like pull at the thread of my interest. I ended up doing a further training in yin yoga, which was all based within the meridian system. And I was like, well, this is nice, but I really want to get stuck in here.
Yeah.
And a fortuitous shoulder injury landed me in a clinic in Collier's Wood, where I realized that they were doing training programs. And because it was acupuncture, they were allowed to practice and they were allowed to do training. So I was like, okay, well, maybe I'll just pop along to one. And this is microsystem acupuncture, which is basically a system of acupuncture which is based in the philosophy that you can treat the whole body within within the hands, the ear, the face, and the feet. So you can just distill a treatment into a body part.
Yeah.
Anyway, I started with that. And I did all of them, and I did all of the courses. And from my facial course, I ended up doing a facial massage training, which blew my mind. It was like the integration of acupuncture and reflexology, and everything that I had been collating suddenly clicked. And I was like, okay,
this is it.
This is the thing. Anywho, then we had another lockdown.
Yeah.
I thought, right, what am I doing here? And I really had the intention of wanting to share reflexology. A lot of my clients were like, how can I do this myself? How can I have a treatment? And I just found it so tricky to try and show the foot, because not everybody wants to look at a foot. And also it's not necessarily the easiest thing to get your foot towards you so you can give yourself a treatment. So after much staring at a wall, I suddenly thought, well, why don't I do this on people's faces? So I started putting together workshops, and they were amazingly busy.
Brilliant.
People really had a demand for them. People, were desperate for a facial. And I'm not giving a beauty treatment, but actually what you're giving yourself by just focusing your energy for 60 minutes on your face is as good as a £200 facial. And I've just basically taken what people are asking for, and I've run with it, and I've just tried to cram as much information into my head as possible.
That's often the best way, though, isn't it? Is letting things, guide the direction rather than trying to force it uphill. I think that organic growth is, it's just the way it works. It's the natural way, isn't it? And I think, and that comes across, in the training that I guess when we were set back in, when was it? Autumn last year, when we were, doing your workshop, and what really I walked away from that workshop, and what there was so much, my mind was full up because if you go into a lot of detail. But I remember lying in bed that night and not being able to really sleep in a way, because what hit me was the breadth of the impact. And people think about jaw tension. People think about, okay, I get bruxism, or I grind my teeth, or I get tension headaches, and they just think, it's just linked to a few issues in and around the jaw. But what I walked away from was the impact on the nervous system, the adrenals, how this tension in the face, shelving all of the aesthetic issues which we're going to come to, but how by targeting the jaw and the face, and by targeting these mechanisms, we're actually impacting upon the whole physiology of the body, particularly the mechanisms of the body that are so implicated in disease. You think about the sympathetic nervous system, we think about all the inflammatory pathways. Essentially all of those things are funneling up, and you're saying that these mechanisms have a way of proactively targeting those in a way that actually feels nice, it's sustainable, and to my mind that's self-care gold, because it's something that people are happy to do, they feel good doing it, but through doing it these mechanisms filter down into the whole body. And that really blew my mind, I think, as a concept, for sure. But it is, isn't it? I mean, just, I guess, I know it's a huge topic, but maybe just briefly elaborate on, why, how is it that by focusing and condensing treatment onto this singular area, we're able to impact upon the physiology pretty much of every cell in the body, from my understanding of it.
Yeah. So, okay, there's two things that I'll implement into this answer. So first of all, I'll just throw out that there's a Japanese school of acupuncture that views the face as a hologram for the whole body. So very simply, if you imagine somebody stood with their arms stretched out, kind of in a stuck in the mud position, the head is going to be here. The neck is going to be between the eyebrows, and they kind of do look like somebody with their arms stretched out.
Yeah, they do.
Yeah. So the nose is going to be the back towards us. So we've got the spine here. The tip of your nose kind of does look like a little bum, which would mean that the nostrils are going to be the hips, which would mean that these lines here are representative of your legs, and your ankles are going to be around here. So with that in mind, automatically you have a map of your whole body, easily accessible. And actually this is where my reflexology fingertips come in. If you can give yourself a full musculoskeletal treatment just by massaging the face and noticing where you feel, and what you're looking for is like areas of sensitivity, or it kind of feels like grit. Sometimes it can even feel like bubble wrap underneath the skin, and in reflexology terms, that's a deposit of uric acid on the nerve ending, and it's the reflexologist's jobs to find those bits, seek and destroy, so that the bloodstream can take any, I don't really like the word toxin, but I'll use it, toxins out to be eliminated. So that's my first answer. And also, this is me kind of with my actress hat on, because my job is literally to look at people's faces and respond with them and work with them. And actually, there is so much information given from our face that we just don't even realize. And this is where there's the Chinese medicine perspective is that the energy of the heart is represented in the face, and in Chinese medicine our Shen, or our spirit body, lives in our heart. So actually we have a barometer of our health and well-being literally
so
plastered onto our face. And if you're not sure about that, just ask your mother how you look and she'll tell you if you look tired. Like, people instinctively know, and that is coming from cues of body language, that's coming from cues of facial expression. And there was a really interesting fact. I think eye lift inquiries went up like 47% during lockdown.
I read that.
So like, obviously we're not used to seeing our own reflection this much, and it's we've had a whole year of really coming face to face with the energy that we're giving off. So And
actually, what's interesting, there was a study done in Germany where it was looking at, it was getting independent reviewers of people who had been diagnosed with cancer but hadn't started treatment, compared to age-matched cohorts who hadn't had cancer. And I think these weren't clinically trained people, they were just off the street. They were given, I think, 50 euros to take part. And 76% of the time, people were able to identify those who had cancer compared to those who weren't. They hadn't started treatment, so they weren't immunocompromised, but they had a pallor, they just didn't have that sparkle in their eye. And I think
that's the sparkle in the eyes.
Yeah, and I think
that is what it is.
Yeah, you can see, like, anyone working clinically, I think as soon as you see someone, it's a lot easier in person than it is in this modality, but you can see whether someone's just a bit flat or whether they're ill. You can see the skin's lost the elasticity. They haven't got, not just the sparkle in their eye, but their face isn't animated. There's like, it's almost like it's been anesthetized in their expressions, their energy, what they're putting out. And I think as a diagnostic tool for ourselves, and not even in clinical practice, but if we look ourselves in the mirror and we actually look at what we're seeing rather than just taking it for granted because we see it every day, you can pick up so many cues of something's not quite right there, or I haven't got that sparkle in my eyes, or I don't feel vital. And that's the cue to do something about it before it manifests as a migraine or a cold or whatever it is. And I think, that's the beauty, isn't it, of these kinds of approaches. It's like, it's self-knowledge. It's being able to understand ourselves at a much subtler level of have I got a temperature, or have I got the flu or whatever it is? And that's the key, isn't it?
Absolutely. And I think that is, if you truly look at yourself in a kind of non-judgmental, we all want to look good, but just putting vanity aside, the body's always in communication with us. And, we can see, dark circles, and actually we could just save ourselves so much time and money. Like, don't buy crap to make your bags better, but actually get to the root. Gua sha, first of all. But like, if you can actually learn that, like, I can spend thousands of pounds on my dark circle, but the root cause, I'm going to bed at 2 and I'm getting up at 6 and I have a lot going on at the moment. If you just get to the root cause, I think that's when people come really empowered in their own healing.
And I think the key, and that's the now, I really encourage everyone to really prioritize next Wednesday, because I know everyone's going to walk away from that jaw tension workshop in the way that I did, which was the mechanisms here are just, I know I'm repeating myself, but the mechanisms here, this isn't something that is just anti-aging. It's not something that's about wrinkles or dark under my circles under my eye. This is something that's affecting my physiology, and that's what this is about. Everyone wants to look good, and when we look good we feel good, but it's going deeper than that, isn't it? It's about saying this is a tool that impacts upon my health and my disease risk factors and the mechanisms that underpin that, and it does it, doesn't it? It's profoundly effective in that capacity.
And the whole jaw tension thing, it is baffling how just like something that is like minorly irritating, and your dentist will tell you about every so often, is so indicative of something that is quite dangerous within the body. It's really indicative that you're in that sympathetic tone, and the body, the act of jaw tension is quite, it's a dangerous gesture for the body. So it's like, if your jaw is causing you pain because it's in that much tension, how do you think the rest of your system is?
Every cell is experiencing that. And that's the thing, is that
every cell is experiencing that.
We'll talk about this in a minute, but one of the things that really I find just always excited me is this idea, when you get something that's 3,000-4,000 years old in any culture, and it's then validated by cutting edge Western science, that marriage of ancient and modern, that just blows my mind. And you go back to Chinese medicine, Ayurvedic medicine, they've been saying in the Ayurvedic text about 4,200 years that every single thought, belief, attitude affects every single energy channel, every cell, every organ in the body. Not some of them or some of the time, everyone all of the time. That's why you look at the neuropeptide research, that's what that's showing now. When we're feeling tense, feeling stressed, feeling anxious, every cell in the body secretes these neurochemicals which says, I'm feeling stressed. So your organs feeling stressed, your liver's feeling stressed, your lungs, your kidneys, whatever, our body's feeling that emotion. And the jaw is a barometer for, we can't really feel our liver being stressed, but we can feel our jaw being stressed. So it's a barometer for saying, I'm out of kilter here because of this, and this is how I fix it. So as a kind of diagnosable, I guess, issue in ourselves, it's really powerful, isn't it? I'm experiencing this, I need to do something about it. And that's so powerful, isn't it, as a self-care measure, as a preventative self-care measure.
And just empowering to be like, and I think this is where injury is actually a gift. Injury, or if you're somebody that gets the same illness over and over again, it's really annoying. It is annoying.
Let's be honest,
frustrating. But actually, what your brain has managed to create is a direct feedback mechanism to tell you to slow down. So whenever we have these niggly injuries that just like crop up, that is your body being like, what pain feels like here, and I know that you do. So I'm trying to tell you to slow down, back off, and give me some rest.
It's not gonna make it worse.
Exactly. And because I have taught yoga a lot, I just could not believe, and myself included, how many people would come to my yoga classes being like, oh, I've injured my shoulder. Just like, go home, put the telly on, and just don't do anything for a little bit. Like, we need to learn how to heal, and especially after a global pandemic, I think the collective has been called to learn how to be in our human bodies and let them heal.
And I think, and that's that's exactly that. I think that's the gift of all of these systems of health and medicine. It's that it's the self-awareness is the key, isn't it? It's being Ayurveda, that's the doshas. And I think the gua sha move, I'm blown away by this little thing because
It is good.
it is good. But what I love about it is, one, because it's new. So obviously I've seen them for years and I kind of knew a little bit about them, but I've never tried one. I've never actually gone through a training program of how to use it properly, the different strokes. And I want to talk about it in two areas. But the first one is again, looking at it from a mechanistic angle, looking at why, because what always interests me is these things have been used for thousands of years, which means they work. If they didn't work, they would have been ditched. But why? Trying to really get into the core here. And I think you said how the translation of this is a scraping tool.
Really sexy.
Sexy, yeah.
Yeah.
For those of you who don't, obviously I've watched all of Harriet's videos and none of you have, I'm assuming. So the gua sha is this tool here. They come in different shapes and sizes from what I understand. I also understand that you don't necessarily need one, Harriet. You could use a spoon or a lid.
And I'll show, I think the spoon is better for the face.
Yeah.
So next week I'll show everything with a spoon. You don't have to go out and get one.
But I would recommend getting one if you like it, because I've used the spoon and I've used the gua sha, and I guess it's like a 3-star hotel or a 5-star. Both you're gonna get a good night's sleep and a good shower. Yeah. But one's a lot nicer. And what I love about this, so in one of the videos, Harriet talks about this, is the translation of gua sha is as a scraping tool, and which isn't the sexiest kind of label, I suppose. But you speak about how it works by creating that pressure, by that scraping motion, you're bringing stuff to the surface. Whether it's toxins, whether it's viruses, whether it's mucus, whether it's anything really, bring it to the surface. And what I think is so interesting is that going back even 10 years, that probably would have been poo-hooed from a conventional perspective. Load of rubbish, this idea of bringing things from inner to outer, core to surface is a load of rubbish. But actually, if you look at it now from some of the more progressive research, there's very clear evidence here that so much of what we excrete through the body comes through the skin, so much more than what people think and what science used to think even 10 years ago. And what I love is this idea of you saying, well, by using these tools, you can help clear infections, you can help clear out toxins. If you've had a nasty infection or kind of things like that, you can use this tool to actually aid your recovery. But again, mechanistically, if you look at it from the lens of conventional physiology, it should have a very, very effective impact, shouldn't it? Because by doing that, by using those strokes, you are affecting the microcirculatory system in the skin, which will affect all of the mechanisms of the skin, from sweat regulation to toxin regulation to lymphatic regulation. So again, mechanistically, it's very valid, isn't it? And I think have you seen that play out in your own life or in your clinical practice, where people have used this to actually bring things out and to fruition as such?
So I actually have been doing a lot of research recently on the lymphatic system, because it's something that practitioners are introduced to, and you see a diagram and you read the lymphatic system does this and this, and you're like, yeah, okay, got it. And a lot of people were like, well, how were saying, oh, I'm feeling really puffy in my face, or I'm feeling like I'm getting water retention. I thought, well, let me just go away and have a little think about this. And actually, what we don't realize is the kind of power center of our lymphatic system is your head, basically. And it's your head and neck. And the drainage board of the lymphatic system is going to be right between your collarbones here. So anything, no matter how small intention of movement you're doing around your neck, is really starting to move lymph. So I actually hadn't realized how powerful DIY massage is around the neck.
Yeah.
And only until recently, when I've really started to deep dive into doing it myself and teaching others, have I realized how powerful it is. And especially around the ears as well. And this is all things that I think culturally we're taught to seek out professional help. And I'm not saying you shouldn't do that, but there's a really big market for lymphatic massage, and people post-op of lymphedema, or, you know, working with certain types of cancers, it is a big financial expense to go and spend 70, 80 quid every single week, which, you know, you do need. But if people can start to learn about this system for themselves and start learning therapeutic tools for themselves, not only are you longer term going to save yourself money, but you're also going to take your healing into your own hands. And it doesn't have to be complicated, but once you have a couple of these tools in your arsenal, then you can really start to treat yourself more regularly than you ever would be able to do with a professional.
Easily.
And I think that is, you know, what amazing what you're doing. You are a practitioner with immense knowledge, and you're offering it up to people and being like, this is what I have to share, please take it and run with it. And I think it's
well, I just think the more you can bring healthcare into the home, you know, I think, you know, I think one of the downsides, you know, Western medicine is profound for acute problems. You have a heart attack, your appendix burst, but it's by its own admission failing miserably when it comes to preventing and treating chronic ailments. And that's where the West is looking east. If you look at the research grants, you look at the way the funding is working, they're looking to Chinese medicine. You have my old department at Southampton Hospital, big funding grants, you know, for looking at Chinese herbs, Ayurvedic herbs, these, you know, lifestyle approaches to prevent and treat diabetes, certain kinds of cancers, cardiovascular diseases. And the beauty of those approaches is once you know how to do them, you don't need anyone else. You bring it into the home, and that kind of sustainable model is the only way I can see the West putting a cap on this chronic disease time bomb. And, you know, again, it's that marriage, because you think about from the Ayurvedic perspective, the lymphatic system is one of, if not the most important system in the body, you know, because everything stems from that. And again, looking at the gua sha face massage reflexology workshop you do, which will be the week after next, I am a little bit addicted to it, if I'm honest. It feels so good. And what again I took away from that, aside from how it makes you feel and aside from the actual aesthetic impacts, which we'll talk about, is virtually every stroke you do, every single stroke you do, I think from top to bottom is working on the lymphatics. I don't think there's one stroke that it doesn't, not just a little bit, but doesn't proactively target a lymphatic vessel or a lymphatic, you know, a node, a gland. And that's all the way up, isn't it? And that, you know, imagine if you're even doing that once a week, the impact upon draining these toxins, the dead cancer cells that everyone's got, the viruses, the bacteria, the pathogens we've all got in our body all the time, rather than, you know, reducing, maybe naturally clearing 70% of those. Imagine if you started clearing 95, 100% of those day after day. The impacts upon our immunity, our energy, our vitality, they're going to be not just discernible to us, but to other people. It's going to have to produce a quantifiable benefit. And that to me is just mind-blowingly powerful.
Also, something else that I hadn't realized is that our lymphatic system can only really work optimally when we're in that parasympathetic nervous system. So our cleanup agents can only work when we're relaxed. So, and that kind of blew my mind, actually, because I was like, oh, well, that's the root of everything, isn't it?
Yeah, pretty much.
Okay, well, that's, you know, 8 years training for that. But if you can, and we all can, learn how to do something that is not only going to benefit our lymphatic system, but get us into that relaxation place, literally by scraping a spoon across your face. I mean, it's the most like bang for your buck you're ever gonna get.
It's not like if it's scraping a spoon against your face and it didn't feel particularly nice, it'd still be worth the effort.
Yeah, exactly.
It feels like I wasn't expecting, when Holly bought this, and she bought the roller as well. When she bought it, I wasn't expecting it to feel like what it feels. I thought it might be maybe not that comfortable, because it's quite hard. The edges are quite hard, aren't they?
Yeah.
Doing it, I know you're obviously using an oil, but I'm kind of a little bit annoyed it's taken me this many years to actually get into using it. But again, I was doing some research yesterday just in preparation for today, and looking at the most recent research around, I want to talk about anti-aging, because I want to talk about it on a superficial level, and I want to talk about it on a deeper level. Sure. But superficially, what the science is saying is, if you think about what the visual signs of aging on the face, there's 3 things that need to be targeted to prevent that, reverse that, slow it down. So increasing the muscle tone in the face,
Mhm.
increasing the elasticity of the skin, and increasing the circulation of blood and oxygen into the face.
Mhm.
If you do 1 or 2 or 3 of those things, your ability to age and your face to look younger than you are increases exponentially.
Yeah.
And again, using the gua sha, mechanistically, that would impact upon every single one of those, wouldn't it? It would impact upon the muscle tone, the elasticity of the skin, and powerfully, because you see your face flushing, don't you? Within about a couple of strokes, you see the blood coming to the surface.
Mhm.
So again, it's as a purely aesthetic, which is important, because if you look good, you feel good, you know. And
100%.
you know, it's not I think people are quite ready to poo-hoo aesthetic approaches, but they have a value. There's a deeper value, which I want to talk about in a minute. But the tool to support the aging of our face, which is where we see aging most profoundly, it's just a mind-blowingly powerful tool. There's no getting away from it, is there? There's no getting away from it, I don't think. And you haven't got any crow's lines.
I mean, I'm 84.
There you
great.
go. Proof in the pudding. But it does, doesn't it? It has those mechanisms to really impact upon the way the age is presented on the human face. It does.
Yes.
So what a tool to have, rather than paying Botox or all those other nasties.
Are we going to get into face reading?
We can.
Okay, so I have been doing some research into Botox, and I just want to say, your body, your choice. Have Botox if it's going to make you feel better, fine. But what is really interesting is that there's a couple of studies being done about this crease here, which is called your glabellar crease. And it has been used as a way of reducing instances of suicidal tendencies in women.
No way.
Yes. So Botox, big tick. I mean, that's an amazing thing. But why is that happening? If you numb the muscles here, which are typically used for anger and frustration, this is your liver site. So in Chinese medicine, those are all negative emotions associated with the liver. So anger, frustration, irritability, that kind of feeling of stuck, and depression. So if you numb your body's ability to make that face, you neurologically can't comprehend that emotion anymore. So if you see that in somebody else's body, your brain, because it no longer has the ability to do it, can't register that as an emotion. So if you have suicidal tendencies, incredible that is a tool that's being used.
That is profound.
But that is also limiting your emotional landscape.
Yep.
And I mean, I am an actress. I watched Bridgerton and I immediately thought, my God, these girls' foreheads are flawless. I'm going to have to go get some Botox. But then I looked into that and I was like, we are culturally choosing to dampen our emotional repertoire to look younger.
Yeah.
And I'm just like, I don't know if that's completely...
You don't need to, just use the gua sha.
No, just use the gua sha, you'll be fine. But also another really interesting thing about the gua sha is, and, you know, lines on the face. If you want a really cheap anti-aging hack, just put a piece of sellotape on that line and then just notice how often in the day you're making that facial expression. And then just notice how often you're having the same emotional response.
Yeah.
And actually the minute, again, this is all root cause, the minute you're like, oh, my recurring emotion is frustration, the minute you start taking yourself out of that situation, or you choose to respond in a different way, you're not going to get that wrinkle. So
what's it telling you? Yeah. And that's one of that's one of the things I guess it's going to digress a little bit now and go off piece, but I think it's an important direction, because one of the things I said to you before we went live, one of the things that really hit me again was, if you look at, so within Ayurveda, something called facelift massage, which has been used, one of the most popular therapies because of the anti-aging craze in the West. But in traditional Ayurveda, the facelift massage was used as a longevity tool. It was used as a tool to preserve longevity and to make sure that we age at a rate that, you know, biologically we age slower than we chronologically age. So that if we're 50, we've got the physiology of a 35-year-old, or if we're 80, we've got the physiology of a 65, whatever it is. And the facelift massage was viewed as an integral part of that. Why? Because the face, the signs of aging on our face have no bearing upon the physiology of our organs. But they went to a much deeper level, and they said, well, if you think about, and this again, it's this marriage of ancient and modern, because in the Ayurvedic sense, the biggest variable of aging, whether we're aging faster or slower, is how we perceive aging. And if we're looking in the mirror, or the still water of a pond as a mirror, and we're seeing a face coming back at us that looks older than we are, we're 50 and it looks like it's 65. At the conscious and subconscious level, what we're seeing is enhanced age. We're seeing, I know I'm 50, but I look older than that. What the brain is actually hearing is old age, old age, old age. And then that then affects the physiology of the body, the organs become older, and it accelerates aging. But whereas if we look in the mirror and we think we look younger than we are, at the subconscious level, we think, wow, and that retards the aging process. So, but again, that's now, if you move that forward 1,000 years, and you look at the human longevity research, what it's showing is that the single biggest, the longevity research is absolutely 100% clear on this, it's unequivocal, that the way we perceive ourselves is the single biggest predictor of aging. And they proved that at the genetic level, the telomeres, we know that if we view ourselves as being 10 years, we've got a whole series of this on the mental, but if you view yourself as being, if you genuinely cultivate a mindset that you're 5-10 years younger than what you actually are, your physiology catches up to that point where you're actually changing the organ systems of your body by changing the telomeres and the telomerase. So in Ayurveda, the facelift massage, it wasn't done it was a means to an end. The end wasn't to look younger. The end was to have a younger body because you perceive yourself as younger. And I subscribe to that wholeheartedly. I'm absolutely convinced on that. And that if we re-perceive the way we interpret our age, that has to be experienced in the body. So if you take this, everyone laughs about it as anti-aging tool. We laughed about it, and crow's feet and lines and all the rest of it. You dig a bit deeper, and actually suddenly the significance of these approaches become even more profound, because suddenly there's a very direct evidence-based link between using this random little tool on your face and the way that our chromosomes are working at the base level of our physiology. And that's, it's not a straight line from one to the other, but it's a line, and it's quite a strong line. And suddenly you can see why in these cultures they age incredibly gracefully, and they maintain this youthful vitality as they age. And could it be because these kinds of approaches, I'm not saying all of it comes down to facelift massage or gua sha, but I'm saying that they're piecing these different approaches together, and individually they're powerful, but collectively they put their body into such a powerful state of youthfulness that the body has no choice but to repel disease. And I don't know if there's anything like that in the theory of Chinese medicine or Japanese medicine, but I'd imagine that must be somewhere in it.
Well, actually, you're holding a jade tool.
Yeah.
And jade has a massive cultural significance about being related to the organs of the kidneys. And the organ of the kidneys is responsible for, and I quote, the grace of aging.
Oh, okay.
So
wow.
The kidneys are kind of amazing, actually, in Chinese medicine. They're basically our battery pack. And they govern all of the bits of the body that are going to fall out or fall off. So your hair, your teeth, the bones, all the bits of us that get a bit crumbly and a bit rubbish, that's all governed by kidney jing. So this essence that we store, again, this sort of battery fuel that we've got. And there is this thing about using jade as something to facilitate. And again, it's all in the language, the grace of aging. So it's not about ignoring the fact that we're getting older, but it's about approaching aging with a reverence and a respect. It's a privilege that not all of us are going to have to grow old.
Yeah. And
I think there does have to be, I don't know, there has to be a change in the cultural narrative to this aversion of being seen as being old, because, and again, this pandemic has shown us it is a privilege to be in these bodies aging. And I think, again, this a couple of things that I think I've peppered into these workshops about Chinese face reading. So these Eastern cultures had this reverence to being able to look at someone's face and go, oh, this line is representative of heartbreak, and these nasolabial folds, which we hate in the West. We just can't stand them. These, apparently, the deeper they were, the more likely you were to get hired for a job, because it shows that you've had an experience of art, life. And so it's so interesting how we in the West are so desperate to get rid of any trace of the fact that we've lived and we've experienced and we've had heartbreak. It's interesting.
It is, and that's the thing, is you start teasing these ancient approaches out, and the more you tease them out, the more sense they make. And actually something that can seem quite abstract on the surface suddenly becomes really commonsensical if you dig a little bit deeper. And that's what the gua sha is almost a bit of a totem for me now, because it showed me how you can look at something that on the surface is a box that comes through the post and you think that's cool and it's good and it feels nice, but you dig deeper and you start really thinking about it. Suddenly it's like an onion, you peel off the layers, and the deeper you get, the more significant it becomes. And I think if you apply that to most things in life that are natural and that are steeped in heritage and history and culture, I think that applies to virtually everything. You can look at a herb like ashwagandha, or you look at it and think, if I use that, it's going to keep my immune system strong. Brilliant. But actually you start teasing it apart and you can see how it works at a deeper and deeper and deeper level. And I think that's what the gua sha has shown me. I think it's been a real eye-opener for me anyway. Just bear with me, guys. I've just got a couple of questions coming through. Jeanette, interesting. I had scraping done when I had acupuncture session. That would be the gua sha, I'm assuming.
Yes.
Longevity series is so interesting. It's one of my favorite ones. Lockdown killed me. I didn't know I had so many grey hairs until I couldn't see my hairdresser. It made me feel so old. Yeah, I know. You put a few exclamation marks there, but it's so true, Daniel, isn't it? Our perception of ourselves would have changed with those grey hairs being there and not being there, and that changes the way we think about ourselves. That changes the chrome. That changes the telomeres, and suddenly we're either enhancing or suppressing these mechanisms. So it's true. Sam, can you ask Harriett where people can get a gua sha from if they like one? Oh yeah, any recommendations of where to get a good gua sha? Because Jade, if you're interested in this, am I right in thinking a Jade one is good?
So if you're I'm actually about to start selling them.
Oh, there you go. Look at that.
So I've spent months sourcing some really fantastic quality jade stones. If your budget is not going to stretch very far, you can pick up something from Amazon that will do the job. But if you're looking, again, having spoken about the cultural repercussions of this kind of crystal tool, if you're looking for a really fantastic one, I personally love the jade stone. Again, it has, like any old crystal, it just feels different. There's something about it. And also the energetic properties, again, are related to the kidneys, supposed to create clear and bright skin, and, the kidney energy, hair and teeth, keep it all going. So if your budget extends to something that you can really make an investment into your well-being, I would definitely go for a real crystal tool, or I'm sure there's some amethyst ones or some rose quartz. But I think they say with crystals, and I'm not a big crystal, I don't have much language around crystals, but I do love them. They say that if you look at a crystal and you want to eat it, you kind of feel like, ooh, I want that one. And that's the crystal that you should go for. Yeah.
And it's so we had Beverly might even be on here actually. Beverly, who's one of our, who we've worked with for a long time. I'm not sure if you're here, Beverly. She was here today because she's going to be doing some work for us, some courses around chakras and crystals, and that's what one of the first impacts when I first got this and got it out, before even using it. I guess it's like any beautiful object. Anything that's beautiful, it resonates more with you, doesn't it? And I think the act of self-care, like if you're doing a self-massage and you warm up the oil, in a random old pot, it's going to work just as well. But if you make a bit more of a ceremony of it, you
ceremony of it.
And this for me, for an extra 10 quid or whatever it's 15 quid, whatever it's going to cost extra, if you enjoy it, something you're going to use, it's going to last forever, isn't it? If you don't drop it, it's not.
Don't drop it. Don't drop it.
But I agree. Like
They all go that way.
And you just want it makes you want to use it, and a bent teaspoon doesn't really have the same effect.
No, and you can get some metal ones which will literally last forever, and I have to say I really didn't get on with them. There's just something about having a real crystal tool in your hand. It just changed the experience. So, and
also in your training, the practical training, the face lift one, the face massage one, you mentioned quite a few times the significant, I hold up against the black so you can see it, of the nick in the top. And actually, having tried a few different tools for doing this, even the straight edge, like on the cheekbone, is not as good as the nick, is it? So as a complete novice here, my one bit of advice is make sure you get one with a nick in it.
And get a deep nick.
A deep nick, deep nick.
Deep nick, yeah. And really does change things.
It's very different, isn't it, to doing that with the nick? Yeah. Very different.
Yeah, and I'm not sure who asked that question, but if you find me, I've got a list of pre-orders, so they'll be going out soon.
Okay, so what we can do, Holly, so that's on your website, is it, Harriet?
Not yet. It's on my Instagram, so if you just
we will post up on our platform a link to
wow, that's so kind. That's really kind. Thank you so much.
Linda, hi Linda. Gua sha, great for stimulating the meridian lines all over the body. It's absolutely. When you hold it up, please hold it still. I'm going cross-side trying to focus. Sorry, Rachel, I move my hands far too much. That's
too flatter over here.
Vicky, please let us know when you sell them, Harriet. So we'll post as soon as Harriet is live to sell, we'll post them up. But personally, I would definitely, having done these trainings and really gotten into it, I would definitely advocate getting a good one with a good nick and one that really visually resonates with you. That I think
visually resonates. Yeah, that's the most important thing. Yeah.
Okay, I've got lots of other things we haven't discussed on my list here, but I'm very aware it's 8:20 and probably need to wrap things up. But before we do that, are there any two things I do want to clarify? So with the how would you recommend using this everything collectively as a self-care practice? Just picking one of them, like the face, the reflexology, the gua sha sequence you do. Is that something you should be doing every day? Is it something you should do once a week? What's your view on how to make the most of this in terms of gain, but also sustainability, efficiency?
I would say the joy of the gua sha tool is, even if you're not giving yourself a full embodied facial treatment, you can sit and watch telly and just do it.
Oh, okay.
So like...
Can you do it on other people? Can you do it to someone?
100%. And everything that I teach you to do on your own face, you could do it on another person.
Okay.
But I just think it's the same as anything. It's like, pick a number that's sustainable for you. If you're really trying to facilitate a change in your face, obviously you want to be doing it a little bit more. But I think with everything, if you try and force yourself to do it, you'll fall off the wagon. So and it just really, again, we've all got a little bit more time at the moment, and hopefully we keep some of the slower pace that the last year has encouraged us all to have, but just giving yourself, when you're putting on moisturizer, I mean, myself included, just slap it on and do it and get gone, but actually just carving out 5 minutes of your day to just really nurture yourself. And actually, I think the more you add these practices in, especially to our face, where most of us are just so insecure and we're always finding faults. I think if you actually spend time to just really cultivate a relationship with the body that you have been blessed with, it just starts to infuse your whole life with a little bit more compassion.
Yeah, and from my personal perspective of using this, I think if you look at the science around behavior change, any new behavior you bolt onto an existing behavior is about 80% more likely to be practiced in 6 months. So if you just do this, you might stick with it, but you might not. But if you're already, so for me, you made a daily self massage is one of the real pillars of self-care. So if you're doing a self massage, it takes very little extra effort. You've got the oil there, so you've got oil on your skin. It takes very little extra effort just to put that oil on your face. And even if you're just doing 2 minutes per hemisphere, you're already doing one, so just bolt on the other one. And for me, bolting this onto that makes this very, very sustainable. And I think if anyone's listening to this, if you're already doing a self massage, and I know loads of you are, then it's a no-brainer, because if you bolt that on, rather than being two separate self-care practices, you've essentially morphed them into one, and that becomes really, really sustainable. So I had quite a lot of questions about that on here, looking at them and what's coming up, and I think that would be my, mirroring what Harriett said, do it when you can, and make it enjoyable, and trying to bolt it onto something else, I think makes a lot of sense. Vicky had to go and get me one. You definitely get one. Vicky, once Harriet's got them, we'll let you know. Just did my massage whilst listening to this. And
so great. Habit
managed to dig my gua sha out. Well done, Danielle. Can't wait until the next one. So yeah, I'm really excited about this. I'm really excited about this because next week's gonna be fantastic. The live. So next week at 7:30 on this platform is the live workshop, and that is definitely not one to miss, because that's the one that kept me awake at night, which is a compliment and not a criticism. And then there's the 3 recorded workshops, which are equally powerful. But I've really bought into this. It's been a real eye opener for me. It's been a real learning curve for me. It's a brilliant topic. It's a whole, don't think of it, like I said at the start, don't think of it as, facial reflexology, and that I don't get tension headaches, I don't grind my teeth, doesn't apply to me. If you've got a verruca, if you've got a liver problem, if you've got high blood pressure, anything that's not right in your body, poor energy, whether it's objective, subjective, these approaches will help, because they're whole body targeting concepts, and the mechanisms around how they target the whole body, every cell in the body, is again very, very clear. So this applies to everyone, whether you're old, young, fit, healthy, or anything in between. Okay, so please check out this stuff. It's really, really, really good. Okay, so I'm so excited to bring it to you particularly next week and over the coming 4 weeks. We'll leave it there. Just a massive thank you, Harriett, for 1, creating the content, and 2, for joining us tonight. We're so grateful for what you've done. I think that's it in terms of questions. I'm going to get Simon, my husband, involved. He's going to love this. So yeah, all good. Get your husbands on it. Do it to your husbands. Do it to your wives. Do it to your kids. You can do it to kids.
100%.
You? Yeah.
100%. And actually, I'll throw in some points next week that you can do on kids. Knock them out to sleep. I teach baby yoga, and this is I pull these boys out when I'm like, I need some quiet.
Wow.
Yeah.
Okay, so good for kids as well. Okay,
great for kids.
So pretty much everyone. So okay, I'll let you guys go on waffling, but thank you so much for joining us, all of our lovely community. Thank you, Harriett, for joining us. Super grateful. And I look forward to kicking off next Wednesday at 7:30. Have a lovely evening, Harriett, and all the rest of you.
Thanks so much. Take
care.
care.
See you soon. Take care.
Thank you.
Bye. Bye-bye.